Okay. Go ahead and read the consent, please.
I, Andrea Jimerson, am over the age of 18 and consent to use of this video for Astoria Mountain Community College for grading purposes.
Okay. Thank you. All right. So we're now going to begin the assessment. Okay. So I'm knocking, I'm coming in. Hi, Andrea. My name is Joe. I'm going to be your student nurse today. We're going to be doing a full assessment. It's going to be head to toe, so we'll go back and forth a couple of times, but for the most part, it'll work from your head downwards. Okay. All right. First thing I'm going to ask is your name and your date of birth. Can you tell me your first and last name, please?
Andrea Jimerson.
Okay. And can you tell me your date of birth?
August 21st, 1987.
Excellent. And do you know why you are here?
For a head to toe assessment.
Excellent. Do you know where you are?
At my home.
Okay. And can you tell me the day of the week?
Sunday.
Okay. Do you know the names of your pets?
Yes, Rain and Stu.
Okay. Excellent. Thank you. So I'm going to perform hand hygiene. Just that stuff there. It's an alcohol sanitizer. And I'm going to just put on a pair of gloves. Okay. All right. To begin the assessment, I'm going to start by palpating or feeling around your skull and your head. I'm just going to be checking for any abnormalities, any bumps that we don't really expect to be there, lesions, or any areas that are actually painful. Does anything feel painful when I feel anywhere around here?
No.
No. Okay. Excellent. And everything feels good to me too. I don't feel any abnormalities here. Okay, next we're going to actually move on to your eyes. So I have a pen light here. And I want you to start off, we're going to follow the tip of this pen just with your eyes. Okay? And I want you to follow it as it moves, but don't move your head, just your eyes, okay?
Okay.
Okay. Excellent. Okay, it's going to move in towards. Just keep a focus on that tip. Good. All right. So what I want you to do is actually stare off at the picture over on that wall. And I'm going to look into your eyes, okay? You just keep taking a look at that. Excellent. Okay. You can turn back towards me. All right, and just look directly into my eyes, okay, without breaking the gaze. Excellent. All right, pupils are equal, round, and reactive, so that's good. I'm going to also just take a look at your conjunctiva, which is underneath your bottom eyelids on the inside, and everything looks good there. And everything is nice and symmetrical as well. And I don't see any lesions around the eye area. Okay. Next, I'm going to go to your ears. Okay. And same thing, I'm just going to be checking for pretty much anything that looks abnormal or anything that's painful. So if you feel any tenderness, just let me know, okay? I'm also going to be checking inside your ears. I'm just going to be making sure there's no drainage, cuts, lesions of any kind. Okay. All good there. Mastoid process also feels normal, equal as well. Okay. We'll be doing your nose next. I'm just going to feel the outside, and same thing, a lot of this is just letting me know if you feel any tenderness or pain. I don't see any redness or discoloration. I'm going to test your sinuses. Let me know if this feels like a lot of pressure. How does that feel? Does that feel painful, pressure, or okay?
Okay.
And same thing here, painful, pressure, or okay?
Okay.
Excellent. I'm going to have you put one finger over one of your nostrils and just breathe in and out of the nostril that's open. Nice and easy, we're checking the patency. Okay, so we're just making sure that you don't have any clogged sinuses or anything like that. Same thing on the other side, please. Excellent. Good. Thank you. And again, I'm just going to have you look up a little bit. I'm checking for any redness, and I do not see anything. Everything's very healthy there. Okay. Thank you again. All right. I'm just going to go ahead and change my gloves. Toss those. Hand hygiene. Okay. Another pair. Be moving on to the mouth next, okay? Okay. I can just look around the lips right now for starters, and everything looks good here. I don't see any redness. I don't see any swelling, any drooping of the facial muscles, so that looks good there. I'm going to have you, if you would please, just open your mouth so I can take a look. Go ahead and stick your tongue out for me. Excellent. And then go ahead and lift your tongue up as high as you can. Okay. You can keep your tongue further back in your mouth. Can you try to lift your tongue up once inside of your mouth? Excellent. Good, good. Everything actually looks very healthy there. Okay. And go ahead, you can close your mouth. Can you just swallow for me, please? Was that difficult? Any pain or
no?
Feel like it was hard to do?
No.
No? Okay, good. All right. And again, change gloves. Hygiene. We're going to be moving on to the neck now, working downward. Okay, and first thing I'm going to check is I'm just going to fill both of your carotid artery pulses. We do these one at a time. Nice and strong on the left and strong on the right. You don't want to occlude both of those at once because you could pass out. So, okay. I'm going to be checking your trachea. It looks nice in midline and also underneath your tonsils. Does this feel painful or tender at all?
No.
No? No pressure?
No. Okay,
good. And then also just around, you'll feel me squeeze a little here. I'm just feeling your thyroid. I'm making sure it is symmetrical and not overgrown or anything. And that all feels good too. Okay. Would you be able to look up at the ceiling with your head, please? So go ahead and tilt your head upwards and then downwards. Chin to your chest as close as you can. Good. And then just look straight up at me. And then I want you to put each ear to the shoulder next to it as close as you can. A little stretch there. Same thing other side. Excellent. Okay, thank you. I'm going to be checking your hair, skin, and nails next. So this is one of the areas where we kind of jump back up a little bit, okay? So first thing I'm going to do is actually just check your skin. I'll be using your arms. And I'm checking the temperature. Feels warm and healthy, good circulation there. And I'm checking your nails. And same thing as everything else. We're checking for lesions, anything abnormal growth, pain, tender areas. And everything here feels good. Do you have good sensation? Can you feel everything that I'm doing?
Yes.
Okay. Awesome. I'm going to have you take your index fingers and put them in a heart shape in front of you like this for me, please. Okay, good. It's called the Scrammuth test. We're checking for clubbing. That lets us know if you're not really getting enough oxygen circulation on the regular, but this looks healthy and good. So you can put your hands back down now. And I'm going to go up and move back up to the scalp. I'm just going to check up there, make sure there's no infestations or anything like that, any lesions on your scalp or in your hair, okay?
Okay.
All right. And everything here looks healthy. Okay, good. Same thing, I don't feel or see anything abnormal. Does any of this feel tender or painful?
No.
As I'm going through. Good. And I don't see any excessive dryness on the skin or hair or anything like that, or the scalp. Excellent. Okay. Yeah. And hygiene again. Okay. We're going to move to the thoracic and chest region now. Okay. So I'm actually, for this, I'm going to have you stand up if you would. And just face me. Okay. I'm just going to be checking for symmetry on the front and lateral sides of yourself and your chest. So I'm just going to kind of move around here. You can stay facing that way, please. Thank you. Everything's good there. Okay. I'm actually going to have you just turn and face the wall, if you would, and just take a couple of deep breaths for me. Right now, I'm just feeling for expansion and any use of accessory muscles while you're breathing. One more breath. Everything feels symmetrical. I don't feel any or see any accessory muscle use. Okay. I'm going to listen to some lung sounds while we're back here, okay? So I'm going to use my stethoscope for that. You can stay facing the direction you are. And I'm going to start from back here. I'm going to be listening to the right upper lung. So just breathe in and out as normal, okay? You're going to feel my stethoscope. It might be a little bit cold. Okay, moving to the left upper lung. Okay, right middle lung. Okay, breath sounds are good. Left middle lung. Okay, and right lower lung. And left lower lung as well here. Go right about there. Excellent. Thank you. I'm going to have you face me again. I'll move to this side so you can face me here. And same thing, I'm just going to listen to the same lung sounds but the front. Okay. And I'm going to start on the left side this side. Excellent. Okay. Okay, I'm moving to the right upper lung now on the anterior. Okay, and then the right middle lung on the anterior. Excellent. Very good. Thank you. Okay, you can have a seat. All right. Actually, I'm going to keep my stethoscope out because we're going to be listening to some heart sounds next. So I'll be checking the heart in general. It won't just be heart sounds. But the first thing actually I'll have you do, if you could, is I'm going to move to this side. And if you'd lay on those pillows right there, just so that you're like 45 degrees. And lay back. Okay. And I'm just checking, this will be brief, but I'm just checking for any jugular vein distension here. You can turn your head towards that wall. Okay, and turn the other direction for me, please. Good, I don't see any distension or veins popping out or anything, so that's very good. Okay, you can sit back up for me. Okay. I'm going to listen to 5 different sounds of your heart. It's going to kind of work across and down, kind of like the dipper. And it's going to start with the aortic, okay? I'll be listening to each sound for a couple of seconds. Okay. S2 also. A little dub sound. I hear the second sound stronger here. I'm going to move over to the pulmonic. Excellent, clear sounds there as well. I'm going to move down a little bit to Erb's point. Very strong here as well. Okay. I'm just going to be here for a second. Okay, I'm going to move to the fourth point. I'm going to have to go just a little bit underneath of the breast, okay? The bra's slightly obstructive. That happens, it's okay. Okay. Sounds are still audible, but a little bit faint. And then I'm going to move to the mitral sound as well. If you don't mind, could you just lift your left breast up just a little bit so I can go underneath with the stethoscope to get a better sound? Thank you. Very strong here. Excellent. Okay. Thank you. Sounds are clear in the heart. I'm going to be checking your pulses, so I'll check your radial and your pedal pulses. Okay, I'm going to check them at the same time. I'm just going to be down here. I'll have your hands. You can turn your hands this way. I'm just going to be feeling. You can relax your arms as well too. Bilateral pulses are clear on the radial and strong. Probably about a +2. Okay. And I'm going to go ahead and check your pedal pulses as well. Okay. So first, as I'm going to check, this is going to be on the ankles. Okay. +2 on the ankles. And then I'll have to have, I can do this from the tops as well, actually. And dorsal pedal pulses are strong as well, also a +2. Okay. Thank you very much. I'm going to perform hand hygiene again. Okay. Next, we're going to be moving down. We're going to be listening to the abdominal sounds. I'm going to touch a little bit around your belly, just making sure there's not any pain or distension or anything. For this, you're going to be laying down. Okay, you can be completely flat. Okay. And first thing I'm going to do is just observe. I see flatness on the stomach. I don't see any distension or bulging, anything like that on the belly, so that's good. I'm going to be listening to 4 quadrants for a couple of seconds, okay, each. I'm going to be starting in the right upper quadrant. Listening for vowel sounds. Sounds are clear in the right upper quadrant. I'm going to move to the right lower quadrant. Vowel sounds clear in the right lower quadrant as well. I'm going to be moving to the left upper quadrant. Clear in the left upper quadrant. Clear vowel sounds. And then finally the left lower quadrant. Okay, vowel sounds are clear in the left lower quadrant as well. Okay, continue to lay where you are, please. I'm just going to go ahead and test with some light touches. Let me know if you feel any pain or tenderness. I am checking for any distension that wouldn't be visible or any pain or hardness or tenderness. Is there any pain when I push or touch here?
No.
No? Okay. What about over here?
No.
No? Good. What about over here?
No.
Okay. And lastly, what about over here?
No.
Okay. Thank you very much. Okay, you can go ahead and sit back up. All right. And for hand hygiene again. Okay, we're almost there. Lastly, what we're going to be doing is I'm going to be checking your musculoskeletal reactions, just making sure that you've got enough strength output. That's normal for your age and gender and etc. Okay, these things. So first, I'm going to actually have you put your arms out in front of you. You can sit down for this, but keep your arms out in front of you, palm up, and just leave it there for a couple of seconds, okay? All right, and close your eyes for me. Okay, no pronator shift visible. You can go ahead and put your hands down and open your eyes. Good. Next, I'm going to be checking for some resistance, okay? But before that, I'm going to be just checking for any tenderness in your joints before we do this. Okay, do you feel any tenderness or pain in your elbows when I touch or squeeze?
No.
No? Okay. And same thing, how about here in your wrists? And it's okay to be honest here. Same as anywhere?
No.
No pain? Okay, good. And what about your shoulders?
No.
No? Okay. How about for your knees? Any pain or tenderness?
No.
No? And ankles? Any pain or tenderness?
No.
No. Excellent. Okay. Hand hygiene again. And I'm just going to test the resistance now of some of your joints and muscles, okay? So I'm going to have you, with each wrist, I'm going to hold your arm steady here. Go ahead and just lift your hand up against the resistance of mine as much as you can, okay? Okay, good. And go ahead and push down against the resistance of mine. Okay, good. And do the same thing other hand. Go ahead and push down against the resistance here. Okay, and then up against the resistance here. Okay, palm to palm, put your palms to mine, and go ahead and push against me. Try to get me out of the way. Good, okay, excellent. And same thing here for your knees. I'm going to hold your ankles and go ahead and raise your legs up for me, okay? Against the resistance. Just push my arms off you. Good, good, that's good enough, okay. Same thing other side, other way, okay? So go ahead and pull my arms in towards you, towards where the couch is, with your legs.
Can I use my hands to?
You can brace. Excellent, good, good, that's really good. Okay, same thing here. I want you to go ahead and raise your feet up off the floor, one at a time. Okay, and point your toes towards the ceiling. Good, good. And same thing on this foot as well, please. Excellent. And go ahead and point your toes down. Good. Same thing on this. Point your toes down, please. Good resistance there. All right. And I'm going to have you very clearly, you can raise your feet up just a little bit for this, and point one on your left foot towards the ceiling, your right foot towards the ground. Okay, and now switch them, please. Okay, good. Thank you. Hand hygiene. And then last, I'm going to have you stand up, please. And go ahead and walk towards the camera there, and then turn around and walk back. We're just checking your gait here to make sure it's even. Excellent, and remain standing. I'm going to have you just with your hands at your side the way you are. Just close your eyes. And we're going to sit here like this, just like you're meditating for just a couple of seconds, okay? I'll let you know when to open. Okay, very good, thank you. You can go ahead and have a seat, you can open your eyes, and you can sit back down. Okay, thank you very much. That was the full head to toe, so there's nothing else, everything passed with flying colors. I don't see any issues there. If you need anything else, go ahead and give us a call. I'm going to put your call light next to you where we had it. I'm going to put your bed back down to make sure that if you get up in the middle of the night, it's not a fall. And then I'll close your door for privacy. If you need anything else, let us know, okay?
Thank you.
You're welcome. And hygiene. And